Welcome, and thank you for tuning in. You're listening to the Beyond 50 radio program. I'm Daniel Davis. If you're thinking or know someone who is suffering from noticeable memory loss, dementia, Alzheimer's disease, or brain damage associated with age, injury, or concussion, at present there is no prescription medication to cure memory loss due to age or brain damage. However, there are natural approaches that support and repair memory by stimulating the repair and regeneration of lost or damaged brain tissue. On our program today, we're joined with Dr. Sandra Bavacqua. She talks about her unique program of reversing dementia and early Alzheimer's naturally. As an expert in the field of blood chemistry and natural approaches to balancing blood chemistry in the fields of genetic engineering, where she is an expert in human tumor biology, she simply makes the complex interactions between our bodies, the foods we eat, supplements we take, and the lifestyles we lead understandable and memorable. I'd like to welcome to the Beyond 50 radio program today our guest who's going to share with us how we can reverse dementia and early Alzheimer's naturally, Dr. Sandra Bavacqua. Dr. Bavacqua, thank you for being back on the program today.
Thank you, Daniel. I'm really happy to be back.
Stuff here. Now, I'm kind of, interested about something when we talk about how we go about doing all this. But first of all, how did you get interested in this field, and what did you see going on out there that maybe you thought it would be time to challenge?
Well, actually, my true interest in this field came about when I started having more of my clients having trouble with memory. They noticed they had trouble with short-term memory or remembering the right word to say, remembering the name of their neighbor, names and words, and it seemed to be quite common in my more mature population. Even in people that were not diagnosed with any sort of dementia, there were memory issues. And because of that, it stimulated interest in me. And then I hit my 60s, and I noticed that, sometimes I had trouble with a word or I know that person. They've been my client for 25 years. Why can't I remember their name? That sort of thing. So I noticed a little bit happening in me. Not much, not often, but there it was. And then I was able to go to a lecture. I went to a lecture of Dr. Dale Bredesen, and Dr. Bredesen was the first practitioner, scientist, I should say, that actually started bringing together the research that had already been out there showing us that this thing or that thing might help with repairing the brain or with bringing back memory. And so Dr. Bredesen and I actually had contact for several years. We put together some programs together, and he went more into the clinical side of things and has now facilities that people can check themselves into for like 4 to 6 months and have memory repair. My interest was more in helping people have memory repair happen at home so that they can do it in the comfort of their own home. So that's what's been happening, and I've been working with quite a number of people, and the results have been startling, really amazing. But I will give credit, Dr. Bredesen, in his research, actually did the work of looking at the MRIs before and after people were cared for, showing that, in fact, up to 80% of lost brain tissue or damaged brain tissue completely recovers as a result.
Now, I remember last time we were talking about this on the program, that it seemed that conventionally speaking, we were talking about things that people hear a lot about, like fasting 12 hours out of every 24, stabilizing, blood sugar, getting a minimum of 8 hours of sleep every night. That seemed to be important. Games that you can do or social interactions that exercise the mind, as well as attending to detoxification of environmental toxins. But you have an approach that seems to be very different than what we would call conventional knowledge, not necessarily wisdom. I think wisdom is when you go deeper than the common thing that's out there. So we'd kind of like to see maybe that you're in the category of wisdom versus knowledge. So talk about what makes your approach different.
Wow, thank you for asking that. So Although all of the topics that you just mentioned are very, very important, and especially that stabilizing dietary blood sugar, we need to connect in our education about the brain. We need to connect the stability of blood sugar with the understanding that spiking of blood sugar causes inflammation in the brain, and now Alzheimer's is being called type 3 diabetes. So that, just to get that connection out there is very, very important. However, what I'm doing is I'm helping people understand how to achieve a bit more than what those standard protocols are doing. We know of natural ways to repair the synapses of our nerves. There are actually nutrients and herbs that can be used, and depending on the individual, programs are definitely individualized from one person to another, but we can repair the synapses of the nerves, and this is what really connects our thoughts. If the synapses are repaired, then memory comes back, especially that short-term memory. It's really pretty amazing. But there's other pieces to the program that are very important too. I mentioned before how blood sugar increases inflammation, but we have to address the inflammation actually that's in the brain itself. And depending on what a person's, we do blood testing of inflammatory markers, and different inflammatory markers tell us where the inflammation is and how to broach it. And there are, in fact, you can go and look online. There's a lot of research that are connecting the intake of certain nutrients or certain fibers, let's say, that actually specifically target different types of inflammation. So inflammation is not just one bucket anymore. It's many buckets, and each person's going to present a little differently, and they need to be individualized so that inflammation goes away, especially when it's the type of inflammation that targets the brain. Also, in this program, we address what we call the HPAT axis. The hypothalamus, pituitary, adrenals, and thyroid have a lot to do with our personality and memory, all of brain function. I think of those organs as the little people on the control panel that are turning the knobs and making us work properly. So they're not only controlling how we think and our personalities, but also like our body temperature and our skin moisture and what's the texture of our hair. All of these controls are happening through that axis. And what I've found is that by attending to the stabilization or the making sure that any issues that are there are taken care of, it makes a huge difference to the person's ability. For instance, the big difference that people say is, I can't believe how much more adaptable I am to stressful situations now. I can be in a stressful situation and not kind of wig out and have a reaction or get snippy. I can go into a stressful situation and feel very calm and wise. And that is stunning. That's a big deal. So what we're finding is that by taking care of that axis of hormone production is incredibly important for bringing back memory. Now, there's also another part of the program, and in those that have indications that they're moving towards Alzheimer's and the production of amyloid beta in their brain, there's ways that we can reduce the production and even stop production, and that's why Dr. Bredesen was so outspoken about saying that in taking care of or in broaching our memory program, we can actually take care of those with early Alzheimer's. And that's been bearing out to be true. I have worked with people with early Alzheimer's with a diagnosis, and it does reverse. So now if it's more moderate or later on, like a more advanced case, they don't seem to be as responsive. But so that we're now starting to understand a process called autophagy. It's it's a way of stimulating proper, what would I say, the environment of the brain is such that amyloid beta production, it has been completely eradicated. And we don't have our finger on exactly how to get rid of what's already been produced, but we can shut down the production. That's really important. Now, another piece that I've found that has been critical in certain cases has been to balance mineral ratios. And there's certain, and what I'm saying is that there's certain minerals that we take in our diet or we take in by supplements or we're exposed to just with the soil that we live near that are affecting our brain function. One of the biggest or most important ratios is the zinc to copper ratio. And I'm finding that a lot of people with memory issues have a very low zinc to copper ratio. And when we broach that, and it's easy to find out, it's a very quick and easy blood test. If it's a problem and you take care of it, it really takes care of a big piece of what gets in the way of recovering from memory issues. So your standard run-of-the-mill dementia or short-term memory issues are attended to by helping to rid the body of copper and bring the zinc to copper ratio back to normal. It should be like a 1-to-1 ratio. This is huge also for people with cardiovascular issues. And I've been seeing a big connection between people with cardiovascular concerns and those that have just your regular type of dementia. So one of the things that we do is we also, in those individuals, will repair and protect the blood vessels, which deeply affects the brain. So if there's vessel issues, any cardiovascular concerns, high homocysteine, we are going to use a nutritional approach. And we can do that with diet or with supplementation. It depends on the individual and what their actual needs are. But we can definitely repair blood vessels throughout the body, including the brain. But we're seeing when people do this, their cardiovascular health really benefits tremendously as a result of going on the brain repair program. And lastly, I would say another difference in our program is some individuals have instability of their hormones and neurotransmitters because they have gastrointestinal issues. The gut controls the balance of our neurotransmitters. In fact, who lives in our gut has everything to do with how well balanced our hormones, and that's our reproductive hormones, and those HPAT or hormones, the adrenals and thyroid and pituitary and such. So all of those hormones are literally controlled by who is living in our gut, what population we have. And it's not the individual bacteria who are living in the gut, but actually the diversity of bacteria. Mm-hmm. So I would liken it to this. If a person has GI issues, chances are they've lost diversity in their gut. Mm-hmm. And Daniel, imagine that we had a baseball team, that you and I are working to manage a baseball team, and we've got to fill the team. We have to fill the field with good players. We're looking for our players. When the gut is like this, but instead of there being, 9 guys on the team, we're going to have 320 different species on our team. So if we're trying to fill second base, it doesn't matter to the body whether the bacteria that fills second base it could be one of a large number of species, because any one of them could be a good second baseman. Like we could have somebody from New Jersey or Texas or the Philippines on our baseball team. As long as they're really good at second base, it doesn't matter where they're from. So what I'm saying is that the diversity is what's more important than actually the species. And when you have diversity in the gut, why diversity? What happens is you have strength in the production of short-chain fatty acids. And those short-chain fatty acids are the signals that control the production of our neurotransmitters and hormones. So if the gut is in good shape, then the brain will probably be in better shape. So there's that gut-brain axis that everybody's talking about. That's how it works. In fact, on my website, I've produced 4 videos to help people understand how the gut not only controls our hormones and neurotransmitters, but it also produces signals that controls our immune system, our weight, and our cardiovascular health. So we're starting to see a big connection between heart health and brain health. And not a big surprise, but kind of a big surprise because that's very new. So in people that need to have gut repair, we do take care of that as well. Everyone needs it. This program must be individualized. Mm-hmm. Each person will present with whatever their particular issues are. So not each person is doing the same program. Each person is doing what they need. So if someone sleeps well at night already, then we're not going to help them with sleep. But they may have a major issue with their gut, or they may have cardiovascular concerns, or they may have mineral ratio issues, and we're going to take care of those. So that's the big difference in this program, is that we really are looking very closely and are individualizing each person's program, and it's working. We do actually have people with severe dementia that are completely returning back to normal life, which is exciting and amazing, and that's really what drives me.
You know, it's really fascinating, too, because over the years we've talked very heavily, if you will, about the brain-gut connection. And mm-hmm. So as last time when we were talking about all this, talking about diet, things like that, you know, when you're out there with conventional knowledge, okay, you know, you just need to have a great diet, okay, but then that seems so blanket for everybody. Uh-huh. And you don't hear much about, well, gee whiz, you know, how is your intestinal tract, your gut, you know, all that really doing? You don't really hear that addressed very much or even brought up in the first place. But yet I know there was a time, and it was really unique, a friend of mine was saying, man, I got a lot of this brain fog going on. I don't know what's going on. And I just simply asked him, as a result of having particular experts on the program, what have you been eating or doing lately? And she explained to me, she says, well, this. And I said, well, why don't you go ahead and eliminate that and see what happens in the next week to 2 weeks? And she was astonished that within just a couple of days, she says, wow, I actually feel clear and everything just changed. And I said, there you go. There's your connection right there. I mean, I'm not a doctor, but I just figured, what the heck? And I noticed even in my own experience the same thing. And they were talking a lot about, for instance, that same connection with children who may be having what they call, you know, the onset of autism. I mean, this is after birth, so to speak, you know, and why is that going on? And you were talking a lot about, you know, heavy metal and toxicity, things like that. So it's really unique to hear what you just described here today. And you realize the brain just doesn't repair itself over time like other parts of the body. Why is that?
Mm-hmm. Well, it can. It can repair itself, but the brain is susceptible to, I mean, we just went over actually 20 different points of what the brain actually requires. And it literally requires that all of those be basically in place. Now, not everybody gets in balance in all 20 of those points, but we have 20 different points to take care of. And when you attend to those 20 different, actually, even if you attend to half of them, the brain recovers rapidly. It's pretty amazing how quickly it can repair. But the other piece of it is, in those that have like those mineral imbalances, or they need synapse repair, they actually need neuronal repair to happen. When we take care of that and put those nutrients or herbs into the body, the response is rapid. It's incredible. I mean, we can bring back the brain does like to repair. It does. It's not that it doesn't and it has to degrade. It's that nobody's attending to it and giving it what it needs. You know how when we get older, there's certain things that we really like in our day-to-day habits. We get used to certain things. And if everything's in place, life is peaceful. It's really lovely. And then, a wrench can be thrown into the works. Like, here I am in Tucson, Arizona. If the air conditioner goes out in the middle of the summer, that could throw a wrench into the works. Life is not peaceful. Okay? Mm-hmm. And the same thing can happen with the brain. And I think what happens is the older we get, the more sensitive the brain is to having the conditions that it needs. If you provide it the conditions that it needs, it repairs rapidly. It's stunning how fast it repairs. You just have to give it what it needs. It wants to repair. These bodies that we have, including the brain, are stunningly amazing, and they do repair. But not everybody's aware of what they need to be attending to, just like you said with your friend. She made a dietary change, and I'll bet that dietary change was affecting her HPAD axis. That foggy brain, that's classic. And that's one of the reasons why our program is different than most, because we are really helping people balance neurotransmitters, hormones, minerals. We are balancing the biochemistry of the body, and the brain responds like crazy.
Yeah, it's pretty astonishing, too, like you said, when you set up the right conditions. And the first thing is you have to have the approach that lets you find out, well, what are the right conditions? As you had mentioned earlier, everybody's different. Everybody's, the big thing, blood chemistry is different. I mean, blood goes everywhere in the body, and I know that's an area that you're very consistently thorough about. But you don't hear a lot about that, and especially in testing. It's more like what happens is you may go to the doctor, they'll kind of guess, and most of those guesses are based on maybe successes they may have had with other people. But other than that, the testing doesn't seem to be as prevalent as what you're talking about here today.
Absolutely. That's very much true. You really have to get detail-oriented when it comes to the brain of a mature person. We have to get detail-oriented and really look very closely. In fact, I had a lady I was working with just yesterday, and what she was dealing with was mercury toxicity. That mercury toxicity came at the point where she decided to remove all of her fillings. But no one told her how to protect herself from the mercury, and her dentist wasn't very well versed in how to remove them without causing himself and her to be exposed to the mercury in her mouth. And she had rapid onset of dementia. She had a lot of issues. There was neurological issues, because mercury is like lead. It's a bit of a neurotoxin. So there are ways of removing the fillings without harming oneself or the dentist. But I have worked with quite a few dentists that have tremendous amount of mercury in their systems because they weren't aware of how to protect themselves in removing fillings. So they're doing good work, but then doing themselves harm. And dementia was part of that issue. So
wow.
Dementia's not great for a dentist. They have to remember their patients.
Isn't that the truth?
Yeah.
Let's see, where was that scraper I was just using? Oh, there it is. That can't be good.
No, it's not good. So, here are these dentists that are doing excellent work and helping the patients, but that became a very interesting case because it was both the patient and the dentist that I ended up working with. So, yeah.
Now, there was a time, there was a guest I had on the program, and this kind of gets into nutrition a little bit. But what he was talking about is says omega-3s apparently are something that he noticed that as he was taking a high quality, I guess, omega-3 supplement, that he noticed that after about 30 days of being consistently on this particular supplement, that he said that his brain went back to a childlike state. And I thought of, how intriguing something like that would be, to think, because as a kid, you kind of just would think about something and go do it. You didn't have the roadblocks. There was a certain sense of magic in life, that things would just work out. You didn't see it any other way. And I know that we did talk about foods and nutrition last time, but, are there herbs or nutrients or particular foods that may be good for a lot of people to consider when it comes to repairing the brain?
Absolutely. There are. And your friend, speaking about the omega-3 fats, especially those that come from fish, I've seen a big difference in between the omega-3s that come from fish versus those that come from flaxseed. There's an anti-inflammatory effect that's very efficient in removing inflammation from the brain. So omega-3s are a great choice for anyone. The omega-3 from purslane, the green leafy vegetable, purslane has an omega-3 that's very effective for the brain. So for a plant source, that's a really good one. Again, better than flax. So there's another way to think of omega-3s, and that is, when a child is born, they still have a lot of brain growth to do. And if you'll notice, children love fat. A child will grab a stick of butter and run away and eat the entire thing. They're looking for fat. They're craving it. Now, unfortunately, they're not going to get the kinds of fats that they need from that stick of butter, or not. Some of that is helpful, but the amount of butter we would need for the brain is maybe a single patty per week. However, there are other nutrients that are essential brain oils, like dexahexanoic acid, eicosapentaenoic acid. These are the oils that come from fish. They're very effective. And the linoleic acids from seed oils are really important too. So these are essential fatty acids for brain function and brain repair. So not only do they act as anti-inflammatory agents, but they're actually repairing brain tissue. So they're great nutrients. But when I think about nutrition for the brain, I go further out than that. For instance, there's something magical about, and a lot of people know about, medium-chain triglycerides from coconut oil. I couldn't speak about this topic without touching in on it. It is actually the 8-chain medium-chain triglyceride that is amazingly effective at repairing brain. Less of an anti-inflammatory, but much more rapid repair coming from that 8-chain. Now, if you get a mix of medium-chain triglycerides, sometimes that causes a little bit of laxity to the bowel. So people have a hard time with MCT oil because of the loose stools, because the other chains will affect, like the 10-chain and the 12-chain, will affect the bowels a little bit. So you have to be careful with those. But what I'm using is a pure 8-chain medium-chain triglyceride, and that is one of the first go-tos. If somebody just has a little bit of trouble with their memory, that might be one of the first recommendations, is to do an 8-chain medium-chain triglyceride. And,
which is what specifically, you say, well, where do you find something like that again?
Well, there's a number of companies that are producing it, but you want to make sure the one you're getting is just an 8-chain. So there's a number
you specifically asked for an 8-chain triglyceride.
Yeah, an 8-chain medium-chain triglyceride. Another easy go-to that is just I'll say a no-brainer. That's kind of funny, but it's a no-brainer is lion's mane mushroom. Lion's mane mushroom extract or the powder itself. And there are people, I've actually got clients that are growing their own lion's mane mushrooms at home to integrate into their diet or in their smoothies. And it does repair brain tissue. So and I would think of that sort of like an herb, but there are so many medicinal mushrooms that are doing amazing things. So we can use mushrooms and different herbs to knock out inflammation, to stimulate growth of the brain. But when you say nutrition, my mind goes into the antioxidants. Vitamin D, oh my goodness, I can't imagine. Still, even with all of the press, I still run into people that don't have enough vitamin D to stabilize their hormones. And the brain is very sensitive to our hormones. So vitamin D, very important. The other, like tocopherols, tocotrienols, the vitamin E type vitamins, carotenoids, all of these are very important. But which ones I choose will depend on the individual and what their needs are. If I have someone that's kind of like, let's say their genetics are towards the cardiovascular, mom or dad had heart issues, and they do have signs of some vessel damage, and you can see it in the blood work. So then I'm going to be looking at giving them some antioxidants, and especially vitamin C, which will produce collagen and start to repair the epithelial layer of their blood vessels, and especially like that person that's constantly bruising all the time, that's really important. Now the brain likes liquidy blood. It just like the heart likes the blood to be a little thinner. As we get older, it's nice to do some blood thinning. And in fact, many of the supplements that are out there that help us, supposedly our mind, help the memory enhancing herbs or nutrients. These are blood thinning herbs or nutrients. So a thin blood is okay, but if it gets to the point where a person is bruising, for instance, the fish oils. If you overdo fish oils, just that alone can cause bruising. So if that person is bruising, they have vessels that are a little more sensitive, and they need repair. And if you repair those, the brain responds. It's just awesome. So that was something that I really, only 2 years ago, I started to see the relationship. So in a person that kind of indicates that we need to take care of their heart and blood vessels, taking care of that and giving them a period of time of repair is stunning for brain function and for long-term brain function. So, yes, on nutrients, let me see. And there's those specialty nutrients, such as, we may look at vitamin K as well, D. The herbs, we're going to be looking at inflammation. If the inflammatory markers say, yes, we have to take care of that, then we might be moving in the direction of curcumin, hops, frankincense or boswellia, ginger, pepper, the piperine. These anti-inflammatory herbs are amazing in combination of safflower flower oil. And there are products that are already combined, so it's not that big of a deal. Or some people will want to just bring them in with their foods, which is okay too. It still works. Let's see. And then, I also look in the area of cognitive enhancement. Our cognition is a part of memory as well, like how well we're figuring things out. And you might have, like magnesium threonate is amazing for helping people sleep, but also getting that cognition to happen. Bacoba is an herb that might be very helpful too. And citicoline I mentioned before. And also the B vitamins, CoQ10. We want to optimize mitochondrial function. And in people that just don't have the energy that they used to, we take care of that too, because they need to have proper energy to repair the brain. So we might be looking at optimizing their mitochondrial function. So that's when we're looking at the alpha-lipoic acid, CoQ10, maybe glutathione and N-acetylcysteine, some resveratrol, and the B vitamins are super important. All of those nutrients are just essential, really. But we only use them in those that need them. Not everybody needs all of this.
Well, and that's the important point to make is, first of all, everybody's different, so that's where, proper testing and procedure come along.
Yes.
Then secondly, once that's narrowed down, then it's dealing with the reasonable balance of what you're introducing perhaps either back into or to the body in the first place. And we, especially in America, we live in a world that says, well, let's say CoQ10 does all this. Oh, man, well, if it does this in those amounts, then more must be better. Then you end up taking yourself over the edge, and, boy, everybody's in a world of hurt after that. And I remember someone actually getting on herbal supplements, and it was suggested they take more and more, and they were just saying, I am just feeling rotten right now. Well, why don't you just kind of get off of those for a while? Because, herbs, I would think, in high amounts can be very toxic, actually.
It depends on the herb.
Right.
Some herbs have to be rotated in order to get the best results. Curcumin is one of those, actually. And berberine should be cycled. But there are some herbs that you could take continuously. I'd say overdosing on herbs, I've seen it happen. I see it mostly happen with some of the essential oils because the oils are so concentrated and people have a hard time determining how much they can take into their body without doing damage. I have seen toxicity issues with overuse of internal use of the oils. Not quite so much with dry herbs or capsules of herbs because it's hard to take in an amount that is toxic. You'd have to take bowling ball boluses of it to hurt yourself for the most part. But it depends on the herbs. Some herbs are only meant to be used for a very short period of time, and they're maybe 7 days or 10 days, and they do their job, and you don't need it anymore. There are some herbs that are so strong that they're just maybe 3 times taking them. It does all the work that they need to do. You're done. You never have to take it again. So all of these, it depends on the medicine that it is. Plant medicine is a whole brand new world, and it's growing all the time. And honestly, Daniel, for me, it's taking a sip through a fire hose because the information is coming fast and furious. The interest in plant medicine has become so beautiful and large and prevalent all around the world. And so more and more scientists are looking at the effect of certain herbs with, let's say, cancer. In fact, last night I was up late doing research for a client of mine to find what herbs would be best for increasing what we call apoptosis, or programmed cell death, to kill her rapidly growing breast cancer. And I've designed a program for her to be able to attend to that. Plant medicine is very strong medicine, and it can be used in combination with Western medicine to great effect. So we use plant medicine when appropriate for people with memory issues. And, it depends on the case. And it depends on the individual and what they're willing to do.
Now, as I've listened to what you've shared with our listeners today about the program, the protocols, the ways that you approach this whole thing that we've been talking about, I couldn't help but some of the things that come to mind, for instance, as people age, and you think of things like menopause, andropause, people start hearing a lot about, well, your estrogen levels or testosterone levels, that common stuff that you tend to hear or read about that's always out there. So go to the men's clinic or whatever it is and do this. And what you're saying here is certainly a lot more detailed, and I can see where this would have a tremendous amount of advantages versus, again, conventional knowledge that seems to be available to us out there. And a person listening today would think, well, I don't really have anything like memory issues, at least I don't think I do. So you have to imagine that with a program like this, it sounds like it can be for everyone as far as its approach to what are your goals. Would you like to feel like that childlike mind again, that clarity, that idea that, it's sort of like that feeling of being in love for the first time. Mm-hmm. Like you just feel like you can do anything and nothing bothers you. God, I miss that feeling.
Well, you know what, Daniel, for almost 30 years now, I've been doing practice where I do blood chemistry balancing. We start with blood chemistry. So everyone that comes to me, the very first thing is we have a quick touch-in. We find out what their issues are. I put together a test of blood chemistries to be done. And our first appointment is after I've analyzed their symptoms they've reported, and our intake form is kind of involved. So we have a lot of details there. And then the blood chemistry comes in, and I do a detailed analysis. I'll spend 8 to 12 hours for preparing for a first appointment. And the first appointment takes 2 hours. So we're going to really go over things in detail, and people learn a tremendous amount of information about their bodies. And I think perhaps an appreciation of the fact that they're living in a biochemical system. So when you balance blood chemistry, what you're describing is what happens. People come back to me and say they feel a sense of awe. They feel the energy that they had when they were younger. They feel like they're looking around and seeing that colors are brighter, like when you fall in love. Everything is more distinct, and they're happy. They're feeling content and satisfied. And that is a beautiful thing. That's what happens when your body is purring. I think of my work as like a mechanic that likes to tune up cars.
Yeah, there you go.
I love my work. It's so gratifying. And what I really love is to work with people that are well. When I work with someone that's well, it's challenging for me, and I love a challenge. I want to find out how to, like I work with Olympic athletes. I've got a number of Olympic athletes that I work with, and they're really fun because they're already so healthy. What we're doing is fine-tuning them and getting the best performance out of that mind and body, because both have to be functioning for their sport. So it's, and what we also see, I see over and over again, is that when someone balances their blood chemistry, and sometimes it's like magic. I've had complete, agnostic, atheistic people that all of a sudden find their spirituality. You balance blood chemistry, and that person wakes up in all areas, mind, body, spirit. So I love my work.
Sounds like what happens there is what you've done with them is you've awakened their tremendous sense of awareness as well as intuition. And that might have been something that had been closed down for years, and they just weren't even aware of something as subtle or profound as that is. That awakening of awareness alone is pretty amazing.
Exactly. And I'm not saying that people are jumping into organized religion.
No, I know it because clearly we do a lot of interviews, and I've done them over the years in the pursuit of religion, religious practice, and I know exactly what you're talking about, and it's an amazing thing to just go, wow, this world is so big, but for some reason, all at once, I can feel everything going on, and I'm part of all of it all at once, and that's an amazing feeling. Sort of like that feeling I think people feel after great sex, like, wow, Yes,
exactly. So that is the kind of thing. And, you can imagine, Daniel, that when I was exposed to the possibility of repairing brain tissue, it's like it falls right into my lap. It already involves so much of what I was already doing, but it's just one step further for repairing brain tissue. And it's so exciting that we're living in an age where we actually can achieve something like that. That's great.
And even more intriguing,
it used to be.
I was going to say, even more intriguing, I was going to say, Dr. Bavacqua, is that we seem to be moving away from, again, conventional knowledge saying, well, once this happened, it's done. There's no way to reverse or change that. But yet more and more often committed people just like yourself say, well, why don't we kind of remove that and look toward the wisdom of things, and see what can actually happen. And it's happening a lot more often.
And let's see, there's another piece that I'm thinking of, and that is there's that piece as we get older. We're thinking about a few things. Perhaps Have you attended to your bucket list? Have you gotten the things done in your life that you wanted to do? Are you enjoying your life? Are you having the joie de vivre, the love of life that you were hoping to have? For me, I don't want to go to my deathbed and say, darn, I didn't get that done.
Right. Mm-hmm.
Or, having regrets. I don't want to do that. And so having our health is very important. And the brain is unbelievably important. If you lose your memory and lose your ability to think, if you can't think your way out of a paper bag, you can't get things done. And I see this over and over again. Like, I've been doing hormone balancing for many, many years. And when you balance, especially a post-menopausal or post-andropausal person, woman or man, what happens is they wake up and all of a sudden they're functional again. And it makes such a difference to their, not just libido, but their love of life. The joie de vivre comes back. So hormone balancing is one of the critical pieces. And I've mentioned it a few times here. I've been doing that for many, many years. But going into the brain repair is just that extra icing on the cake that is incredible. So I encourage people to do this. If you notice that, if I've said anything that strikes a bell with you, do work with someone that you think is going to be able to help you. And take care of it. Don't just put up with it, because we're here for a very short period of time. And if you don't get your health, you can't have that peak, amazing life where you're lying there on your deathbed going, gosh, that was an awesome ride. That was amazing.
Right.
No matter what happens afterwards, you did well while you were here.
Now, here's something I want to know, because you've covered so much, certainly. I mean, this is very detailed, and you can see how a program like what you're talking about is very different. Where you even start from just is different alone by itself. But, so here's somebody, I'm listening to this, but maybe a Dr. Bredesen dementia facility, or perhaps working with you, they're maybe too far, but what would be questions, things people would talk to their doctor about that can move them in this direction? I mean, what could be done there?
As far as talking to their physician, physicians don't have a lot of tools right now to work with dementia. There's no medication that reverses Alzheimer's. We don't even have a natural way. We can stop the Alzheimer's process, but we can't reverse the heavy beta amyloid production, as I mentioned before. We can. What are you going to talk to your doctor about? What you can talk to your doctor about, that the doctors are very, very helpful in getting the blood chemistry that you need. And doing a detailed blood chemistry analysis is amazing. One of the things that I notice, though, is some doctors, not all, think that once you're in your older years, you don't have to have your hormones measured. It's like, you're postmenopausal, or you're in your later years.
There you go, conventional knowledge.
That's the conventional way,
right.
And that is so wrong. I tell women this all the time. I just finished actually an online course for women postmenopausal women to understand how they can naturally balance their hormones. And I can't tell you how many women have gone to their doctors, and the doctors say, you're in your 60s, you're in your 70s, you don't need your hormones balanced. You don't need any hormones. And that's so not true. The suffering that happens for women alone, it's cardiovascular, it's increased chances of having reproductive tissue cancers, increased chances of dementia. You lose your mind, you lose your heart, get cancer. It's awful. But one of the other pieces that we don't know much, we don't hear much about, is that the hormones deeply affect the base of spine, pelvic floor, and all of the muscles that attach to that area of the body. So a postmenopausal woman also is going to have probably some problems with bone density. All right, she'll be losing her bone density because she doesn't have enough estrogen and testosterone to maintain her bones. They're both really important, and they must be in ratio to get your bones to balance. So I've been doing that kind of work for a long time. So getting bone balance or bone density back is not a hard issue. But if you don't attend to at least a little tiny bit of hormone in proper balance, they have to be in correct ratio with each other, all of them. What you do is you lose the energetic, let me see, the whole pelvic floor is hormone sensitive. Its function is based on the presence of systemic hormones. So what happens in an older woman, and in some cases in older men, is that you lose your ligament tension. So you get ligament laxity, and also there's Chinese practitioners that will tell you that the qi, the energy movement through that part of the body, is tremendously affected by hormone imbalance. In fact, a lot of the Chinese medicines that are given for imbalance have to do with balancing hormones. And so if you lose that connectivity, what happens is you lose your balance and you can fall down and go boom. And that's why especially older women get very tottery as they get older. And then that with the low bone density is a disaster. And so you have to balance the hormones to be able to bring that together. So the hormones are not just for the brain, they're for maintaining strength, posture, and energetic movement through the body. All of that is important.
You know, as I was saying before, there seems to be a lot of different parts to the program, but you can see how it's possible with perhaps people with dementia, or perhaps if you don't have it, but you just want to improve the quality of your life, that you can, obviously we talked about last time, there are many things that you can do at home without having to check in full time, maybe to a facility or something like that. But still, it's important to, at least when you get started on this path, perhaps you're not in that devastating realm of dementia and Alzheimer's, but if you are getting to that point as well, the starting point is, as you were talking about, you want some really good test workup. You want to know where you're at so that you can move forward with the right protocols. That doesn't mean that you have to be there every day, but you're moving forward, and then a lot of things you can eventually start doing on your own home, correct?
Absolutely. You know what, Daniel? I work with people all around the world. We can make connection with each other by phone or by Zoom, and what I will do is, help them with understanding where's the pieces that they need to take care of. Well, what are the pieces that need to be attended to, and then they're the ones that decide. I do not prescribe. I'm a PhD. So I don't diagnose and I don't prescribe, but I can list out what are the issues that might be important for you, for each individual, and then we can prioritize them, and that person can make at-home changes that will attend to those. And they can just do one thing at a time, or they could do a couple of things at a time, or they can jump into the pool with 2 feet. They can jump in, and it's fun to bring back your health. It's exciting. It's a wonderful thing. And when the switch gets flipped, it's so obvious. It's such it's like. It's not linear. It's not like if you need to take care of 5 different issues and you take care of 3 of them, you don't notice something. You take care of 1 of them and you'll start to notice. And we can take a look at what's the most important one for you. Mm-hmm. So people make their own choices. They choose how they want to do it. Actually, my job is to come up with a list. I am the menu producer. So I say, okay, we've got a goal here. I may give 6 different ways for you to achieve that goal. And you may look at the list and say, there's no way I'm doing the first one. I would never do that. But the second one, I could do that. And the third one, actually, I'm already doing some of that. So there you've designed what you're going to do, and it has to work well in your lifestyle or it's not going to happen. And that's one of the big problems with physicians is, or, some healthcare providers is they're saying to people, you must do this. And that person says, I don't want to do that. So they go home with the prescription or the recommendations, and they're like, I don't really want to do that. So nothing happens.
I was thinking of a scenario like about the gym. A, you won't go to the gym if it's 5 miles or 10 miles out of the way. And
right.
B, you won't go, like, for instance, when I have joined a gym, I make sure there are a couple of things they have to have. You have to have a hot tub, you have to have a steam room, and you have to have a sauna. If you don't have those, because to me those were incentives to go to the gym. But once I knew I was there to use those things, which sounds lazy, but I knew, well, why not work out? And then I can really go and enjoy those because I'll feel good about the fact that I've done this other thing, And
exactly what I'm talking about.
Right.
You have to make it work for you. And if the sauna and jacuzzi and steam room are your go-tos because they're so kind to your body, and they are kind to your body, it's good for all of us, one or the other or all three. Using temperature is amazing for many, many, many reasons, but that's the icing on your cake. That's your dessert. And so it gets you there and it gets it done and you stay fit. That's beautiful. That's how you make it work. Mm-hmm. But some people would never go into a gym. They're like, they're gym phobic, and that's not going to happen. So we work out a different way. We work out some way that works for them.
Absolutely. Well, this has all been really a wonderful thing to talk about here today. Could you give our listeners some information, maybe a website they can go to find out more about your work, the Bredesen Dementia Facility, things like that?
Absolutely. Actually, I'm very happy to help people in this way. If you want more information, or if you just have questions about your needs or a loved one's needs, then every week I put aside just a little bit of time for free 15-minute consults. So if you can nab one of those, that would be great. You can do that by contacting me through my website or calling the office. So if you're going to call, the phone number is 520-743-0575. And if you prefer to go online, my website is www.drsandy, as in boy, E-V as in Victor, ACQUA.com, drsandybavacqua.com. And you can get lots of information on that website. In fact, I've done there's an MP3 talk for you to learn more about how to get your memory back. You'll learn more information than we even went over here. And you can also schedule your free 15-minute and just find a date that works for you. And I'm happy to help you.
Well, you certainly helped us today, realizing there's a lot to this. But again, as you said, hey, don't complicate it. Take it one step at a time. And the first step is find out where you're at, and we'll show you how you can actually help you get to where you want to go. Is it pretty much that simple?
It's pretty much that simple. It's exactly that. And there's more information that you can get on my Facebook page, so you might want to consider going to the Dr. Sandy Bavacqua Facebook page. And there's lots of free events. If you go onto the website, you can tell the website what kind of free events you would like to know more about. And as events come about, you'll be notified only for those that you've checked off. And so you're not going to get a lot of emails, but occasionally we might have something that will interest you.
Ah, very good. Well, Dr. Bavacqua, thank you for taking the time to come on the program and share this with the listeners. I think you'll stir a lot of wonderful excitement, enthusiasm, and engagement as well. And that's your website is Dr. Sandy Bavacqua.com is the website, correct?
That's right, drsandybavacqua.com.
And we'll certainly have a link at Beyond 50 Radio as well so people can find out more. Thank you for being on the program today. My memory feels better already.
Aw, thank you, Daniel.
Hey, great conversations. I know one of the things we talked about earlier was engagement in relationships and social activity. That's something you can do. You don't have to go see a doctor about. So get out there and get active, especially when it comes to meeting and being in a relationship with other people. Is certainly one thing you can do today, and that's certainly what we did. Thank you again for being on the program today.
Thank you so much.
We want to thank you, the listeners out there, for joining us. You can discover more at beyond50radio.com. That is the number 50, beyond50radio.com. You can sign up for our weekly e-newsletter and keep up to date with what's going on in the world of Beyond 50 as well as our upcoming shows. I'm Daniel Davis. Thank you for joining us. This is the Beyond 50 radio program, and remember, live your day past halfway.